Top 15 Care Worker Interview Questions and Answers. 1. Tell me about yourself. I am a caring, patient, and responsible person who enjoys supporting people in their daily lives. I understand that care work is not just about completing tasks, but about helping people feel safe, respected, and valued. I have good communication skills, and I always try to listen carefully to what a person needs. I am comfortable helping with personal care, daily routines, meals, mobility, and emotional support. I also understand the importance of dignity, confidentiality, and safeguarding. I would describe myself as dependable, calm under pressure, and willing to learn. I want to work as a care worker because I genuinely enjoy making a positive difference in someone's life. 2. Why do you want to work as a care worker? I want to work as a care worker because I find this role meaningful and rewarding. I like helping people maintain their independence, confidence, and quality of life. Many people receiving care may feel vulnerable, lonely, or frustrated, so I believe a kind and respectful care worker can make a big difference. I also enjoy practical work where every day has purpose. This role allows me to support people with daily living, but also to offer patience, comfort, and encouragement. I understand the job can be challenging, but I am motivated by the chance to help others feel safe, respected, and cared for. 3. What qualities make a good care worker? A good care worker needs kindness, patience, reliability, and strong communication skills. In care work, every person is different, so it is important to listen carefully and treat each individual with dignity and respect. A care worker should be observant because small changes in someone's mood, health, or behavior can be important. They also need to be calm under pressure, especially when someone is upset, confused, or unwell. Trust is very important, so being dependable and professional matters. A good care worker should also understand confidentiality, safeguarding, and teamwork. Most importantly, they should genuinely care about helping people live safely and comfortably. 4. How would you handle a difficult or upset service user? If a service user became upset or difficult, I would stay calm and avoid reacting emotionally. First, I would listen carefully and try to understand what is causing their frustration. Sometimes people may be upset because they are in pain, confused, tired, embarrassed, or feeling unheard. I would speak gently, give them space if needed, and reassure them that I am there to help. I would never argue or force them unnecessarily. If the situation involved risk, I would follow the care plan and company procedures. I would also report the incident to my supervisor and record the details accurately so the right support could be provided. 5. How do you protect a service user's dignity? I protect a service user's dignity by treating them with respect at all times, especially during personal care. I would always explain what I am doing before helping them and ask for their consent where possible. I would make sure doors or curtains are closed, keep their body covered as much as possible, and never rush them unnecessarily. I would speak to them politely and avoid making them feel embarrassed or helpless. I would encourage independence by allowing them to do anything they can safely do for themselves. Dignity also means respecting their choices, culture, routines, privacy, and personal preferences. 6. What would you do if you noticed signs of abuse or neglect? If I noticed signs of abuse or neglect, I would take it very seriously and follow safeguarding procedures immediately. I understand that abuse can be physical, emotional, financial, sexual, or neglect-related. I would not ignore it or try to investigate it myself beyond what is necessary. I would make sure the person is safe, listen calmly if they disclose anything, and avoid asking leading questions. Then I would report my concerns to the safeguarding lead, manager, or appropriate authority according to policy. I would document exactly what I saw or heard, using clear facts, dates, and times. Protecting vulnerable people is always a priority. 7. How would you support someone with personal care? When supporting someone with personal care, I would always be respectful, patient, and professional. I would first check their care plan so I understand their needs, preferences, mobility level, and any risks. I would explain what I am going to do and ask for consent. During personal care, I would protect their privacy by closing doors or curtains and keeping them covered where possible. I would encourage them to do what they can independently, while offering support where needed. I would also observe for any changes, such as bruising, pain, skin problems, or discomfort, and report concerns appropriately. Dignity and safety would always come first. 8. How do you handle confidential information? I handle confidential information carefully and professionally. In care work, I may learn personal details about a service user's health, family, finances, routines, or private life. I understand that this information must only be shared with people who need to know for the person's care and safety. I would not discuss service users in public areas, with friends, family, or other service users. I would follow company policies on records, electronic systems, and data protection. If I was unsure whether information should be shared, I would ask my manager. Confidentiality builds trust, and protecting someone's privacy is a very important part of care work. 9. What would you do if a service user refused care? If a service user refused care, I would respect their choice and not force them. First, I would calmly ask if there is a reason, because they may be tired, embarrassed, in pain, anxious, or unhappy with the timing. I would explain why the care is important and offer choices, such as doing it later or in a different way. I would encourage them gently while respecting their rights. If the refusal could affect their health or safety, I would report it to my supervisor and follow the care plan. I would also record the refusal accurately. Respect, patience, and communication are very important in this situation. 10. Why should we hire you as a care worker @_circle? You should hire me because I have the right attitude for care work. I am patient, respectful, reliable, and genuinely interested in helping people. I understand that this role requires more than just completing duties, it requires compassion, professionalism, and trust. I would always follow care plans, protect dignity, maintain confidentiality, and report concerns properly. I am also willing to learn and improve because every service user has different needs. I can stay calm in challenging situations and work well as part of a team. Most importantly, I would treat every person I support with kindness, respect, and the level of care I would want for my own family. 11. How do you handle working under pressure? I handle pressure by staying calm, organized, and focused on priorities. In care work, situations can change quickly, so it is important to think clearly and not panic. I would focus on the most urgent needs first, such as safety and well-being, while managing my time effectively. I also believe communication is key, so I would inform my team or supervisor if I needed support. Taking a structured approach helps me avoid mistakes and maintain quality care. I understand that service users depend on me, so even under pressure, I make sure to remain patient, professional, and attentive to their needs. 12. How would you support someone with dementia? Supporting someone with dementia requires patience, understanding, and clear communication. I would speak slowly, use simple language, and maintain eye contact to help them feel comfortable. I understand that people with dementia may feel confused or anxious, so I would reassure them and avoid correcting them harshly. I would follow their care plan and routines, as consistency helps reduce stress. I would also pay attention to nonverbal cues, like body language and mood changes. Most importantly, I would treat them with respect and dignity, ensuring they feel safe, valued, and supported in a calm and familiar environment. 13. How do you work as part of a team? I believe teamwork is essential in care work because good communication ensures consistent and safe care for service users. I always respect my colleagues, listen to their input, and share important information clearly. I make sure to complete my tasks responsibly so others are not affected. If I notice something important, such as a change in a service user's condition, I communicate it properly during handovers or through reports. I am also open to feedback and willing to support others when needed. A strong team creates a positive environment where both staff and service users feel safe and supported. 14. What would you do if you made a mistake? If I made a mistake, I would take responsibility immediately and not try to hide it. In care work, honesty is very important for safety. I would report the mistake to my supervisor as soon as possible and follow the correct procedures. I would also make sure the service user is safe and that any harm is minimized. After that, I would reflect on what happened and learn from it to avoid repeating the same mistake. I believe mistakes can be opportunities to improve, as long as they are handled professionally, responsibly, and with a focus on improving future care. 15. How do you ensure service users feel comfortable with you? I ensure service users feel comfortable by building trust and showing genuine kindness. I introduce myself clearly, speak politely, and listen carefully to their needs and preferences. I respect their routines, culture, and personal choices. I also maintain a friendly but professional approach, so they feel safe around me. Small actions, like remembering their preferences or checking how they feel, can make a big difference. I avoid rushing and give them time to express themselves. Over time, consistency, respect, and good communication help build a positive relationship where the service user feels relaxed and supported. Care worker interviews are not just about giving perfect answers, they are about showing your attitude, empathy, and understanding of responsibility. If you can communicate clearly, stay calm, and show genuine care for people, you already have a strong advantage. Remember, employers are looking for someone they can trust with vulnerable individuals. So focus on being honest, professional, and confident in your answers. Prepare these questions well, practice speaking naturally, and you will stand out. If you found this helpful, keep learning, keep improving, and you'll be one step closer to landing your care worker job.